From ESMO 2019, the best update in GI malignancy, specifically the pancreatic biliary malignancy, was a trial, in my opinion, that was presented in HCC, in hepatocellular carcinoma. And it was a trial that had two arms. One arm was randomized to HCC patients that would receive either combination of treatment with a checkpoint inhibitor, atezolizumab plus Avastin, versus atezolizumab monotherapy. And that specific arm did meet its primary endpoint with improvement in progression-free survival with a PFS of 5.6 months compared to 3.4 months. The hazard ratio was 0.55 and the p-value is less than 0.05. The other arm was a monotherapy arm of the combination of atezolizumab and Avastin, and they did meet their overall response rate, which was the primary endpoint, which is approximately 36%. So that to me was very exciting because now we're seeing a combination of a VEGF-targeted drug with bevacizumab with a checkpoint inhibitor as a frontline in the treatment of HCC. However, in the monotherapy arm, there was about approximately 30-something patient had grade 3 and 4 adverse events. So I do think in the larger study that will go forward, it's good to keep an eye on tolerability. But at the same time, there's another trial that combined lenvatinib, which is a drug that targets VEGF, FGFR, PDGFR, KIT, and that trial is approved. Lenvatinib is approved at frontline in HCC, but this trial was studying the combination with pembrolizumab and has been presented previously at ASCO. However, these were updated results, and the updated results still showed really a great overall response rate of 40-something. Although some of the CR/PR were unconfirmed, but still that's robust in the world of HCC, where we're seeing a combination of VEGF-targeted drug or TKI drugs combined with immunotherapy and having more options to treat patients with HCC. In terms of pancreatic cancer, the updated results of the POLO trial were presented. Results of the POLO trial were presented at ASCO GI this year, and did show that patients who have germline-mutated BRCA cancer after upfront platinum-based chemotherapy, showing a response versus stable disease for 16 weeks, going on a maintenance treatment with olaparib, which is a PARP inhibitor, did show a PFS improvement. So it did meet its primary endpoint. And although there was no overall survival benefit, that trial was 46% mature yet. So they're still analyzing the survivability data. However, updated results were presented at ESMO 2019, and we're still very exciting, which did show that time to progression and time to first line subsequent therapy and second line subsequent therapy were still significant in the arm of patients who did go through olaparib. Albeit there was some side effects such as fatigue, decreased appetite. However, at least for me, that means that right now we're seeing a shift towards doing molecular profiling in pancreatic cancer. In fact, the NCCN guidelines recommend considering for patients who have germline mutated BRCA cancer to consider going on a maintenance therapy with olaparib. So I do hope in the future we're going to see more drugs targeting both those cancers that could be potentially molecularly driven.